Okay, hello everyone. We're going to be talking about the Shoepitch today and how to use it, whether to use it, and maybe when not to use it. I've got Christiaan Mertens here with me. I'm going to explain it all in details. We had a lot of answers and a lot of feedback. Christiaan thought actually that we've got it all sorted now, but probably having it all recorded and presented will be useful for a lot of people here anyway. Christiaan and I have met in Budapest, I think 6 years ago, during the Ottobock camp. Would you like to say a bit more about your career and what you do?
Yeah, thank you. Thanks a lot for letting me be here. So yeah, I'm Christiaan. I think I started my career in 2011. I was 3 years prosthesist, and afterwards I worked with Ottobock. I did as well prosthetics as orthotics, and afterwards I gained more respect for the orthotic field, and then afterwards I was a technical specialist in Ottobock, Belgium and Luxembourg.
Mm-hmm.
And then afterwards, now I'm working for 6 months at Patient Care Ottobock in Belgium. So that's in briefly terms what I did as a career.
So if you spotted Christiaan with a large group of students in Leipzig this year, that was definitely
Yeah. Yeah. So as well, what we're now doing within Ottobock Patient Care Belgium, we're starting a masterclass with orthotics, so that we have all the knowledge that we had within Ottobock or have within Ottobock, try to get them also within Belgium and Luxembourg as well. That's the main goal of Ottobock Patient Care now.
Mm-hmm. Good, very nice. Okay, do you want to say a bit more about the Shoepitch and why we should use it, or maybe whether we should use it?
Yeah, so this is one of the things that is most important for me, because I'm now trying to do it like 8 years within Ottobock, so try to use the Shoepitch. So there are a lot of terms around here. So the term Shoepitch, toe pitch, effective heel height. So we have to know what this actually is. So I have a presentation for you. So I'm trying to get the presentation now. An effective heel height, it's not the same as just heel height. And there is a negative thing if you call heel height. I'm just speaking about my experience in Belgium. So if you say heel height, it's negative. I don't know why, but I always say effective heel height is not the same as heel height, and I want to prove it. So if you have just a base shoe like this, you can see also on the screen, inside the shoe, it's what matters and not the outside. So if you have the base of the shoe and you have the front of the shoe and you detected it, then you have 1 or 1.5 centimeters average effective heel height. So this is important to know if you have a patient that wears an orthotic. Because if you, this is what you want to have an angle of 90 degrees. So that's what they told you here in Belgium. We want to have your calcaneus and your tibia at 90 degrees. But this is what Belgium does. So you have a foot plate that's straight. So I have an example as well. So this is a straight foot plate. And also your angle is in 90 degrees. So your calcaneus and your tibia, it's 90 degrees. But there are some problems with it. If you see the first picture, you can see everything is planted on your orthosis and your shoe. So there is contact there. But if you see with the right picture, there is no contact there. So there are just angles of contact, but not very much. This is a problem for patients as they're going into the shoe, because you are going into the shoe, their toes are being squished by the orthotic and as well as the shoe, because you have a straight plate. The second problem is you have an air cushion. If there is an air cushion, this is the way that we would toe off. This is the bent side of it. And if you have air underneath it, it hasn't contact with the shoe, so it's going to break after a while. It's just going to tear apart. And that is what we see at Belgium many times. The third one is your heel is going up and down and up and down in that shoe, because if you have your orthotics and you have heel strike,
I can hear you slightly less. Could you move slightly? Yeah. Sorry.
So no, perfect. So if you have heel height and your heel strike, then your heel is touching the shoe, so that's no problem. But in mid stance and toe off, then your orthosis is rocking forth and back on that pitch. So that's why your heel now here is coming higher and your toes are going lower, because you have that air cushion that there is. And that could be friction between your Achilles and the sock and the shoe. So, and then you have some wounds that could occur.
So we've seen that like a lot of orthotists had the opinion, like the same opinion as you do. So why do you see so many patients not having it matched properly?
Yeah, I think there is a lack of knowledge between we artists and also the paramedici. So if you see a physiotherapist or a doctor, we should explain everything. So the knowledge that we have, we should explain it to, as well as a physiotherapist, as a doctor, that we are one team and that one team is trying to the perfect solution for that patient. And this is why as well I made a PowerPoint presentation to see that it's visually more attractive than just taking a shoe that's closed off and say, okay, you have an effective heel height. Nobody can see it visually. So that's why I just cut off everything. It's my girlfriend's shoe actually. And then you can see everything what it's inside. And if you take a plate that it's flat, that this is not the way to go, then you can see it's wrong. So if we see here, this is the plate that I'm talking about, the picture left. Then you can see everything. What I said was that's a problem inside the shoe. And they're going to try to fix the shoe around the orthosis. But normally you should take the orthosis and fix it around the shoe. And left is more for adults and right is more for pediatrics. So you can see as well with pediatric that there is no, or if you use polyprop or carbon, or it doesn't matter what you use, you always should have an effective heel height or a Shoepitch inside. That's very important as well for the patient, as well for you, as well for the materials that you use. So there are prefab manufacturers like Ottobock, for example. Then you have an effective heel height inside the shoe, inside the orthosis as well. So that's why you can see as well already on the picture that it works perfectly. If you see now here, this is 1 centimeter heel height. Also, the shoe is 1 centimeter. So this is how it should be. The base of the plate is contacted everything on the base of the shoe. And then you don't have breakages. You don't have, and you have a place for your toes. So you have to know why you should do it. So that's one big reason, is the toe has place and don't have like hammer toes like that. And as well, if you see, this is a picture of a corpse, just frontal plane, sagittal plane. What do you say?
You use your girlfriend's shoe. That's not your leg, is it?
Yeah. I just asked it beforehand, so it was okay. And then if we see here, this is a very important video, I think, and you can see that the medial tarsals are first bending for certain degrees of range of motion, and afterwards the calcaneus drops. And if they say at first they say if you have something under your heel, your calcaneus drops immediately. And that was intriguing for me, so I tried to investigate everything. And then I took some X-ray photos of myself on the costing aid. So I took 2 reference points of my calcaneus and try. Now this is 0 centimeters effective heel height without any toe pitch, but you can see that the 26 degrees of the horizontal. So this is my calcaneus standard default settings. So if we now took 0.5 centimeters, then you can see I took the same reference. It's just a copy, and then it's 26 degrees. So, and if we take 1 centimeters, it's 26 degrees at the same reference points. 1.5, 26 degrees. So why is that? Because your foot is very flexible. So your metatarsals is dropping now. It's not your calcaneus dropping, because if your calcaneus is dropping, then you can say, okay, we have a shortened of your gastrocs. But now it's not. And this is very important also in pediatrics. If you have a pediatric child that you can go to 90 degrees, then effective heel height will not affect the shortened of your gastroc. I'm saying this as just I observe, I just try to see it, but there's no studies such things. There has to be a study, I think, about this one. Yeah, if somebody feels to have a study with this, feel free to contact me. But yeah, this should be a study. That we say the effective heel height within 1.5 centimeters has no effect on the lengthening of the gastroc or the soleus.
So this is a call for papers.
Yeah, yeah. So if we see now, this is interesting actually, within 2 centimeters, then we see a drop of the calcaneus. But in a normal shoe, if we see a normal shoe like this, and this is normally the shoe that everybody wears in the physiotherapist, it's like a sports shoe, then we see that it's a 1 till 1.5 centimeters max effective heel height. So if we know this, that there's 1.5, there's no effectiveness at the shortening of the gastroc, then this should not be any problems. It should not give any problems for the patient. But if you go higher at 2 centimeters, then I think, and if you go more, it's like 2.5, 3, 4, 5. Then you can see the calcaneus dropping a lot. So at 5 centimeters is 15 degrees. So that's quite a lot.
That's really interesting. Probably in children that will be slightly lower, but still, if you use 0.5 centimeter or centimeter, that should be still great. So
yeah,
good insight.
Yeah, it should be fine for children, because if you have shoes that adaptive, orthopedic shoes or semi-orthopedic shoes, with semi-orthopedic shoes, there's still effective heel heights. Some people don't notice, and you have to measure semi-orthopedic shoes as well for pediatric childs, because I didn't come any semi-orthopedic shoes that are 0. For example, everybody thinks that all stars are flat, but they're actually 0.8 centimeters effective heel height. So there's almost 1 centimeter, but you cannot see it on the outside. You have to measure it on the inside, and that's very important for making an orthotic.
Fortunately, there are tools to do that. You don't have to cut the shoes, every shoe.
No, you don't have to cut the shoes. You have a tool to measure the effective heel height. That's of course a much better solution. Yeah.
Okay, thank you very much for that. What do you think? Because obviously people have different kinds of shoes. So what's the solution here?
So if you have a patient, you have to explain to the patient that this is important. Every patient that I have, I explain, okay, this is inside. You can see that this is contact everything. So there is a problem. If you wear shoes that are like this, then your alignment of your orthosis is different, because every orthotic should be aligned. That's very important. And if you have 2 centimeters higher or 2 centimeters lower of the first time that you aligned an orthotic on this shoe, yeah, then you have a problem. And I just try to explain, if you have this one, you can take that tool with you and try to get the shoes that are the perfect pitch. Or there is just a simple trick, and the simple trick is, if you have here your orthotic and this is sliding in, then you put your you put your toes against the wall, and then you measure the wall distance between your cuff and the wall. And afterwards, if you take a new shoe and the heel height should be higher, then you can see that this occurs, and the distance between the wall and your cuff is shortened. Then you know exactly, okay, this is not the right heel height for me. They're just tips and tricks that you can use, but it's really important, because if you don't use it, the patient can walk very badly. And also for safety reasons, we have to align every orthotic as well.
Yeah, and stability as well for children with CP, for instance. That's super important. So I think it works with parents, most of them, but sometimes, that's difficult.
Yeah, and you have to also, some patients, they don't want it, or you have to try to talk with them, get their confidence, get their trust, and afterwards you can talk about the Shoepitch or everything else. If you just talk immediately about Shoepitch, everything just technical, then you can lose them, and that's not so good as well.
Yeah, well, with adult patient, I had a patient once who, like, we were making a cafe for her, and it was, I think she was like a post-stroke patient, and she used to be like very elegant, wearing very smart shoes, and she just could not accept that. So like for every fitting and etc., she would bring different shoes. And that was like a nightmare. Very difficult to explain that actually a smart shoe, a heel raise, like 3 centimeter heel raise, is not going to work here. And we can't just fit a cap in there. But
and some people you can do very good, something when go very right. But if the patient doesn't know it, or can't accept the fact that has to happen, you can do whatever you want. It will not happen, fortunately.
True.
Yeah.
Okay, thank you so much for this very nice presentation, very visual. Is there anything you wanted to add, or you spotted in the comments and you would like to talk about?
No, I just I hope that everybody has this knowledge, tries to get it more to the physiotherapists, doctors that we have. That is one team, that everything that is on here, that the knowledge is spread around every single object that's around the patient, and that we try to think more in the way that effective heel height is one for safety, one for comfort for the patient, and that the patient is central, that we are working around the patient and with the patient, instead of just just materials. It's just it's just really a theory. And thank you for so much comments. And I think 99.9% of everybody has agreed with also visual aids. Thank you for that as well. I think it was an eye opener that so much people know this. So we have to keep pushing and keep trying to take this knowledge to the field.
So here's a homework to everyone who watched. Pass it to a friendly physio or a friendly doctor, and we may build something in the group, like Christiaan mentioned. Thank you very much. It was really nice, really clear, and I'll definitely come back to the presentation anytime I need to explain it to someone.
Super. Thank you.
Thank you.
Bye-bye.